2 weeks ago, I took my dog to Mexico to get leg surgery because US healthcare is unaffordable even for pets, and it was about like a third of the cost over there. I couldn't really afford it either way. I just put my credit card down and sang Kumbaya. But anyways, I was nervous because I had to do a follow-up appointment to get his staples out after 10 days from the surgery, and I couldn't go back to Mexico in 10 days, so I had to set up an appointment to my local vet here in the States. And I was worried because it's like, when like humans go do like dental work or like any other type of healthcare work, they kind of get judged. Well, I didn't want that. But anyways, his staples had to come out, so there was no choice. So I called like the receptionist and I'm like, oh, hey, yeah, my dog had leg surgery. He needs his like, staples taken out or whatever. She's asking questions. And then she kind of like suspects, and she's like, oh, where did you take your dog to the vet? And then I was like, oh, it was the vet in Mexico. And she was like, okay, hold on just a minute. She puts me on hold, and I think she's like asking like if it's okay, for them to take out the staples there. And then she's like, oh, okay, yeah, I think we can fit you in, whatever. And so I take him in, and then they ended up telling me that like his staples were on a bit too tight because like the skin was kind of growing over it. And I was just like, okay, like I didn't know what to say. Like, it's either I get his leg surgery done in Mexico or I just don't at all because it's so much money.
Welcome to Nice Finance. If you're reading the title, you already know what this video is about.
I was listening to this podcast of this doctor talking about all of the problems that we're facing with our health in this country and everything that's wrong and backwards with our healthcare system. He was saying that one of the biggest problems, especially with this next generation, is the medicalization of normal life. He was talking about how children are being diagnosed with ADHD at crazy rates for not being able to pay attention in class. Ozempic is being prescribed to overweight children. Medication for anxiety and depression is being handed out like candy, basically. Birth control for period cramps, acne, hormonal imbalances. Now, I'm not against medication, but I am against medication being prescribed at the first sign of a problem without trying anything else. Because we've gotten to this tipping point in this world that we've created where kids are required to sit indoors in a classroom for 7 hours, get fed absolute garbage food, and then we have the audacity to say, no, actually, something's wrong with you. Here's a pill to take for the rest of your life, and here's another one for the side effects. That is crazy and so sad. Instead of fixing the broken system, we're just medicating our children like crazy, and something needs to change.
Healthcare inflation is out of control. Healthcare inflation is exploding at a rate not seen in more than a decade, galloping ahead of other costs in the economy. And the bad news is that there is no slowing down in sight for the explosion in healthcare premiums. In 2025, they're set to grow even further. Healthcare deductibles are also increasing, and now the average family premium, which includes what both the worker and the employer pays, is well over $25,000 a year. This astronomical amount matters because it makes it even more difficult for businesses to hire people. So it's yet another reason to be skeptical that the hiring market has rebounded. Of course, you can use your own eyes for that, as plenty of people struggle to find jobs for months at a time. One important thing to keep in mind is that healthcare costs change at a different rate at other costs in the economy because they tend to be locked in via contract, especially where hospitals are concerned. And hospitals in particular have been increasing their contract values so that they can pay their workers more. So once again in this country, the cost of healthcare is galloping ahead while the quality of healthcare is falling behind.
We talk about how it's just cheaper than it is to live in America, even when you have insurance. I just got off the phone with my cardiac clinic and they said, your insurance doesn't want to cover your echocardiogram. Okay, cool. It's not like I just got diagnosed with a heart condition or anything. Immediately after I hung up the phone with her, I got a phone call from the collection agency that we've been paying $600 a month to for the last year. Because if you let them go long enough, they will start to threaten litigation and they will try to garnish your wages, saying your payment plan is up next month. We have to rework it. Your payment's gonna go up. I've had 2 kids in the last 5 years. I had back surgery and started years of chronic pain management when I was 21. Years of mental health services gallbladder taken out, a D&C for miscarriage. Now I'm having heart problems. It's really hard not to feel like a burden, especially when I'm a stay-at-home mom and I'm the one that's accumulating all these medical bills. I can't contribute to the household the way I want to, and we're bleeding money because I just want to know what's wrong with me. I hate it here.
I called the health insurance marketplace today because I wanted to get a quote for health insurance that includes dental and vision for me and my son. She said the most affordable plan we have is between $400 and $500 a month, $15,000 deductible, okay, $50 copay to go to your PCP, $100 to go to a specialist, like let's say a behavioral pediatrician for my son. And it doesn't even cover my son's dental. Only adult dental does it cover. That was the cheapest plan that they could offer through the state marketplace. So then I was like, well, what about a plan for my son, since I am not paying that? And she goes, okay, well, just for your son, it's going to be a $35 copay every time he goes to the dentist. I'm like, okay. Like, this is the problem with this country, okay? You either are poorest and you get all the benefits. Trust me, I've been there. When I was a college student, I've been there. You either are poorest and you get all the benefits, or you're richest and it doesn't matter to you because you make enough money where you can pay whatever you want to get your teeth fixed or go to the dentist or go to the doctor, whatever. But if you're a middle class person, you get basically, that's how it works. So at the end of this, something happens to me. Like, I don't know what to tell you. I am not paying $500 a month so I can have a $15,000. She goes, if it's just you, it's $7,500. So if I want my own plan, it's $7,500 deductible. But if it's me and my son, it's $15,000. You guys, I'm seriously done with this. Done with this.
Listen, our healthcare system is broken. And if you can't see that, you've got a problem. Because let me tell you, I have a job where I have decent health insurance. My employer pays for part. I pay for part. I just got back from urgent care. I have the flu. They prescribed me medicine. I went to pick it up and my insurance has declined paying for it. When I asked why, the pharmacy was like, well, they just want you to do a different brand and they won't pay for this one. I said, well, how much does this one cost? $200. Who the f has $200 laying around to pay for medicine they need to get well and go back to work? Make it make sense.
Is anybody else realizing that this health insurance is a scam? So let me get this straight. I pay you hundreds of dollars a month to still have a high deductible so that when I go to the doctor, I get a slight discount. It's like a coupon. That's all I'm really getting. I'm getting a slight discount. I'm still paying out of pocket, right? So I'm paying you hundreds of dollars a month to still pay out of pocket, right? Like, I had an MRI schedule that I was supposed to get done. So I was like, cool. I mean, I've been paying health insurance, so I would assume that a majority of it is going to get taken care of, right? Or at least all of it. I don't know. I never had this plan before, right? So the hospital reaches out to me and says, well, in order for your insurance to cover a majority of it, you're going to have to pay $830 out of pocket. I'm sorry. I thought they were with me. I thought you must have called the wrong number. Nope. We need you to pay $830 out of pocket before you can get the MRI, and then your insurance will cover the rest of it. Do you think I ever got that MRI? No, I didn't. Right? So I'm just kind of over this whole fear that I'm supposed to have that makes me want to continue to pay the insurance companies in case something major or catastrophic happens. Right? Like, I've been paid you this whole last year, and I went to the doctor one time and needed some done. And that didn't even get covered. So what the f am I going to keep paying you for if I'm literally still paying for it? At this point, I'm about to just raw dog life. And if something bad happens, must be my time to go then.
Mike Johnson, Speaker of the House, has promised that they will again try to repeal the Affordable Care Act. He didn't say what he would repeal it and replace it with, just said it's going to go away. So if you're a small business owner or an entrepreneur the way I am, you'll be left with no health insurance. My family is ineligible for health insurance without the ACA. I'll remind you, they tried to do this a dozen times in the past. And it was never, let's repeal it and replace it with something, or let's repeal it and transition into a new program. They have no program, no plan. They just want to end it, which would take 50 million people immediately off of health insurance. So that is a pretty big motivator to vote for Democrats in the House and the Senate, because we need to have both houses to keep control of the laws that are passed. And if they have control of either of those houses, they can try to push that through. So please do not neglect your down ballot races. Vote blue all the way down the ballot so we can keep a majority in the Senate and take back the House.
A major problem facing the United States healthcare system is the severe shortage of nurses that hospitals are experiencing. If you look at the chart below, many of the largest states in this country are facing nursing shortages in the tens of thousands, and experts estimate that this shortage will persist through 2030. This is an enormous problem. First of all, as we know, during COVID, these nurses, our healthcare heroes, put their livelihoods on the line to take care of those most vulnerable during such a turbulent time, and we owe them a debt of gratitude. But our nurses are some of the most important people in our healthcare system. There's so many different types of healthcare systems that it's incumbent upon this country to do whatever it needs to do to increase our nurses.
And made this video a million times, trying to sit and think about, as a health economist, all of the things that I am incredibly concerned about going into 2025. And I thought I would outline them here. I'm hoping my concerns are not thought through, but this is just what I'm thinking. Project 2025 has said that they plan on fully gutting Medicaid. So all of the Medicaid expansion and just Medicaid in general will be unraveled if that plan goes forward. In the United States, more than 88 million people, including 40 million children, are enrolled in Medicaid. And if Medicaid is unraveled, all of those people will lose their health insurance. I've made a video about this before, but Speaker Mike Johnson and Project 2025 has said that they plan on also unraveling the provisions of the Affordable Care Act. Without replacement, which I have not seen a replacement plan in 7 years, so I have nothing to go off of. Repeal without, you lose coverage for people who are on their parents' health insurance until they're 26 years old. You also potentially unravel the Affordable Care Act exchanges, which currently over 21 million Americans receive their health insurance coverage there. I've also said this before, but one of my major concerns with this election is that RFK Jr. would be put in charge of all of the major health organizations in the United States: the Food and Drug Administration, the National Institutes of Health, the Centers for Disease Control and Prevention. And so all of the research we are doing in science and public health, all of that research agenda gets redirected elsewhere. I was already concerned about pharmaceutical development and innovation with the Chevron doctrine. This makes me even more concerned about potential pharmaceutical development and innovation. I'm also concerned about the state of reproductive rights in this country. I know several creators have made a video about this, including me, so I'm not going to go into about this, but I will link a video down below. And as a healthcare researcher, this is a hard day of seeing a lot of different provisions and policies we have put in place to help people potentially be unraveled instant. And I don't know where we go from here. The only thing I can hope for is that the plan to replace whatever they plan on repealing is better and has better health outcomes, but that's really all I have to go on right now. So if you have any questions, let me know.
So Wiseacre just made a video. I'll try to tag it here below, but I wasn't able to stitch it because I think it was like 4 or 5 minutes long. But it kind of terrified me a little bit. And it has to do with Trump repealing the Affordable Care Act. And I know a lot of people, when they hear Affordable Care Act or Obamacare, it's like, oh, well, he's giving health care to illegals. But that also grants people like me, self-employed business owners, affordable rates of insurance because we don't have a corporation to pick up the huge premiums. Now, I support a family of 4 on a single income in the Northeast of America. I still pay about $18,000 a year in health insurance premiums. And that still carries like a $6,000 per person deductible and a $17,000 a year family out of pocket. So it doesn't cover a whole lot, but that's the price of small business here in America. And Trump wants to raise that price by repealing the Affordable Care Act. A double in my health insurance premium would eliminate all of my disposable income and probably start putting me into debt. Either that, or I would have to raise my prices to offset that cost. So for everybody who voted for him, do they think the price of things are going to go down? Good luck shopping small, because those prices might go up too, probably more than the big box stores.
Xenophobia. You think health insurance and healthcare in general is unaffordable because immigrants are flooding the emergency rooms? You're out of your mind. You're simping for billionaires, I bet. Anywhere else your posts exist, your comments, you're simping for billionaires who Corporate greed and the cabal of the insurance industry and the healthcare industry together have created an unaffordable system. It doesn't have all to do with undocumented workers. Undocumented workers put food on your... You people are disgusting individuals. Disgusting.
If you enjoy the content, please consider subscribing, sharing the video, and giving it a thumbs up. Until next time, take care.